Health and Human Services Secretary Robert F. Kennedy Jr. made several controversial and often false claims about COVID-19, vaccines, and measles over the weekend during a contentious interview with CNN's Dana Bash. Many of his claims flat out contradict established scientific evidence. Joining us now to do some fact-checking, Dr. Omer Awan. He's a practicing radiologist physician in Baltimore and currently serves as a professor and vice chair of education at the University of Maryland School of Medicine. He's also a senior contributor for Forbes. We're grateful he is joining us this morning because we have a lot of fact-checking to do. It was a pretty outrageous performance. So let's dive right into it. Doctor, thank you. Here's what Secretary Kennedy said about the death rates in the United States during the COVID pandemic.
Damage to our country was the lockdowns that shut down 3.5 million businesses in our country with no due process, no just compensation. All of our churches closed, our schools, and our children are still paying the price for that. And yet we had the worst outcome of any country in the world.
How so?
We have the highest death rate from COVID of any nation on earth. Well, what I said was accurate. We have the highest death rate from COVID of any place.
There are other countries that had higher.
Actually not accurate. In reality, according to Johns Hopkins University of Medicine, numerous countries recorded higher cumulative per capita COVID-19 death rates than the U.S. That includes Peru, Bulgaria, and Hungary. And 9 of the top 10 states with the highest death rates per capita went for Trump in the 2016 election. In 2020, 8 of these states went for Trump. Doctor, this is a blatant misrepresentation. Your thoughts?
Yeah, it's a misrepresentation and it's not factually accurate. We are not even in the top 10 for highest COVID death rates, and partly because of the success of Operation Warp Speed and the vaccines that were disseminated that were life-saving. Remember that the COVID-19 vaccine saved more than 1 million lives, according to research. And those statements by Secretary Kennedy undermine actually the efficacy of vaccines. And he later goes on to say and says that he does not question the efficacy of other vaccines, but here he is clearly questioning the efficacy of the vaccine, particularly because he didn't understand that, the United States did not have the highest COVID-19 death rate.
So we'll get more to the vaccines in a moment. But first, Secretary Kennedy also placed a lot of blame on President Biden and Dr. Anthony Fauci, particularly regarding the COVID lockdowns. He also claimed hospital ICUs were empty during the height of the pandemic, including here in New York City.
Anthony Fauci was mismanaging the COVID pandemic, and he was doing it under the Biden administration. President Trump wanted to end the lockdowns. And in fact, in Anthony Fauci's diaries, he talks about how President Trump is calling him every day, trying to get him to reopen the country.
Yeah, well, the lockdowns were done by governors. I mean, certainly Anthony Fauci and the president had opinions, but the lockdowns were done by governors, and largely because they were hearing from hospitals saying that their ICUs were overrun and they needed some help while that was happening.
Well, that's not true. That's just not true.
It is true.
What you're saying is not true. No, they were doing it because Anthony Fauci was telling them from the top, you need to lock down. There were ICUs that were empty all over the country, including in New York at the height.
Kennedy's claim is false and frankly infuriating. In March of 2020, FEMA sent 85 refrigerated trucks to New York City to serve as temporary morgues because hospitals in the nation's largest city were at full capacity. Hundreds of bodies had to be stored in those trucks. Additionally, the U.S. death toll from the coronavirus surpassed 400,000 in Trump's first term, again, according to Johns Hopkins. I mean, doctor, this is such, and it's a lie, but also such an effort to shift blame and to frankly diminish the suffering and toll that these Americans who lost their lives and their families went through.
Yeah, it's deeply concerning, John. I mean, you are sitting in New York City. I'm sure you remember that ICUs were flooded in New York City, and you saw probably tents in Central Park dealing with and treating patients. And to put blame on Dr. Fauci, who is a public servant, I want to remind people that he spent decades of his life helping people like Americans and saving their lives, not just with COVID-19, but also with the infectious disease responses of things like HIV, and Zika virus, and Ebola. You know, we definitely owe a lot of gratitude to individuals like him. And to put blame and to shift blame on, these public health officials, that not only undermines science, but also, it demystifies and really it shifts the over complexity to the pandemic, because it's more a result of vaccine hesitancy, the polarization, the politicization of vaccines, old age and people's age, socioeconomic status, health disparities. These are all reasons why a lot of people died. So decisions were not made in a vacuum, and certainly it was a collaborative effort. So to pinpoint, to scapegoat one individual, as has been occurring, is problematic.
Dr. Omer Awad, thank you so very much for being with us this morning. His invaluable fact check of RFK Jr. is available online now at Forbes.